Hello students, today we are discussing another category of personality disorder called dramatic or emotional behavior. We all know that personality disorder is a mental disorder that is marked by deeply ingrained and lasting patterns of behavior which leads to inflexible, maladaptive or antisocial behavior to the degree that an individual's social or occupational functioning is impaired. We all know that personality disorders are enduring and pervasive patterns of behavior which deviate from the norms of the society. So, in this cluster B personality disorders, we find different categories called histrionic, narcissistic, antisocial and also borderline personality disorders. Now, we will be discussing about different symptoms associated with each of these personality disorders. Histrionic personality disorder. It involves an excessive emotional expression and attention seeking, including an excessive need for approval and inappropriate seductiveness. It usually begins in early adulthood. If you see people with histrionic personality disorder, they are constant attention seekers. They always want to be at the center of attention, often interrupting others in order to dominate the conversation. And they use high grandeur language even to describe everyday situations, and always they seek constant praise from others in the social interaction. These histrionic people also dress provocatively or sometimes exaggerate their illnesses to get the attention of others. They also tend to exaggerate their friendships and also other interpersonal relationships, and they in order to believe that everyone loves them. So, even their normal interactions, normal relationships, they try to show in pomp just to satisfy themselves that everyone likes them. But actually in their interpersonal relationships, these people are very manipulative. The second category is narcissistic personality disorder. These narcissistic personalities tend to have an exaggerated sense of self-importance, and they are absorbed most often in their fantasies of unlimited success. These narcissistic personalities seek constant attention and always oversensitive to failure, complaining about multiple physical disorders. Like just to get the attention of the others, throughout the day or almost every day, you see them complaining about some physical symptom like headache, fever or any kind of a pain or ache. So, just to get the attention of the others. They always want that everyone is attending to them all the time. Another symptom or another pattern which you see in the narcissistic personality disorders is they are prone to extreme mood swings between self-admiration and insecurity. Either they are highly admiring themselves at some times or completely feeling insecure, because deep down they know that they are very manipulative. It is not that really they are getting the attention of the people, but they are forcing the others to attend to them. So, this kind of a conflict between self-admiration and insecurity always puts them in the middle, and they also exploit interpersonal relationships, whether in the family, at workplace or in the society. So, these are the characteristics of narcissistic personality disorder. Now, coming to the another category of cluster B personality disorder, that is antisocial personality disorder. I think the name itself is indicating what could be the characteristics, what could be the patterns of antisocial personality. Antisocial, you all know the meaning of it. It is something which is deviating from the society, doing something harmful to the people in the society by engaging in some kind of a destructive behavior or also destructive thoughts. So, people with this antisocial personality disorder, generally they ignore normal rules of social behavior. These individuals predominantly you see them as impulsive, irresponsible and callous, and most of them they also have a history of violent behavior, irresponsible behavior, aggressive behavior, which may be sometimes even leading to the violent relationships. They have no respect for other people's rights, thoughts, feelings, emotions, and they do not even show the remorse, that is they do not even feel any sadness with regard to the consequences of others' life situations, but they may just try to ignore the feelings of the people, feelings of the thoughts and the actions. Antisocial personalities are at high risk for substance abuse because it helps them to relieve tension, stress and also feelings of fatigue and boredom. So, among these personality disorders, antisocial personalities, one of the main characteristic is they are at a higher risk for alcoholic and drug addiction. The next category of cluster B personality disorders is borderline personality disorder. These borderline personality disorders, it is something like where you do not see them as completely abnormal, but at the same time they do possess certain characteristics which indicate that they are not normal personalities. So, these borderline personalities are mainly unstable in interpersonal relationships, their behavior, moods, feelings and thoughts. That instability is the predominant pattern among these borderline personality people. Most often they are prone to sudden and extreme mood swings, and sometimes they also involve in stormy relationships. Sometimes their behavior is unpredictable and these people also engage in self-destructive behavior. So, that instability is the main predominant characteristic of this category of people. These borderline personalities have a great sense of difficulty in establishing their own identity, and they often experience the world in two extremes. That is, either based upon their experiences, they view the people in completely black or in completely white. That is, they believe either completely good or they feel completely people are bad. It is something like all or none principle. And apart from this, they also form intense personal attachments, just because like they want to maintain some kind of a dependency also. They just want that constant approval of others, that someone is liking them or someone is trying to attend to them. So, they quickly form good relationships, but immediately you see them dissolving the situations. The instability is one of the reasons for this kind of dissolution in relationships. And another symptom associated with borderline personality disorder is fear of abandonment and rejection, which leads to an excessive dependency on others. Sometimes, as we discussed, it is two extreme relationships, either they completely believe others and then try to depend on them, or sometimes they completely feel that they need not depend on others, or they do not want to trust others. So, because of this fear of rejection, they always want to depend on someone or the other in getting the things done. And self mutilation or suicidal threats may also be used to get attention or manipulate others. Generally, extreme suicidal tendencies in one person can also be the result of this personality disorder. Either to get the attention of the others, they try to threaten others that they want to commit the suicide, or they may engage in self-mutilation just to grab the attention of the others. Impulsive actions, persistent feelings of boredom or emptiness, and intense anger are other traits of this disorder. So, the extreme anger outbursts you see in this kind of a personality disorder. So, very unstable mood swings you see with this personality disorder, borderline personality disorder. So, cluster B includes these different patterns of the personality disorders, and these are the different symptoms associated with the personality disorders. What are the causes that are leading to this kind of personality disorders? The exact cause of personality disorders is not known, but once again the evidence points out to the interplay of genetic and environmental factors. If a person has a history of the personality disorder, definitely the presence of the environmental factors may also be influencing this genetic base, and the interplay of these is resulting in the person suffering from the personality disorder. Some experts believe that traumatic experiences which occur in early childhood may be the predominant cause for the occurrence of the personality disorders in a later life. That could be one reason, traumatic experiences during the childhood. Then other researchers indicate people are genetically predisposed to personality disorders, or they may have a biological disturbances that is related to the anatomy or electrical or neurochemical. So, we all know that neurotransmitters also influence the way we think, behave and feel. So, any disturbances in the release of the neurotransmitters also affects the way we think, the way we act and the way we feel. Then coming to the treatment, treatment approaches can be used in varied ways depending upon the intensity of the problem, intensity of the treatment that is needed, and also the therapist discretion. So, some of the treatment approaches which we can think about are cognitive behavior therapy. This CBT focuses on improving the patient's way of thinking, the way they have to react, that is in terms of their feelings, and also the behavior. Whatever their confused way of thinking or confused way of behaving, that would be identified by the therapist, and they would let the client know under what situations this kind of a behavior is occurring or how that behavior can be modified. Then another treatment is dialectical behavior therapy. We call this as DBT. It teaches how to take responsibility for one's own problems and how to deal with conflict and negative situations, that is negative feelings. And this therapy can be used either as an individual therapy or also as a group therapy. Then play therapy. Generally when we are dealing with the children who are having or adolescents who are having this kind of a personality disorder, for these people play therapy is highly recommended, because this helps them to identify what are their inner feelings and emotions or the thoughts which are blocking their present behavior. And in this therapy, the equipment that is given to them is toys, dolls, puppets, drawings and other games which help the client recognize, identify and verbalize the feelings. Then family therapy is another treatment which can be used. This therapy is designed to help the family function in a more stabilized and effective manner, come forward to help the client in a more positive and constructive ways by exploring different patterns of communication and providing them the support and education. So, in this family therapy, the family members are taught as to how to communicate, like what sort of a communication has to be used, which words or which phrases may affect the client or which pattern can really help the client to understand or get the feeling of the support from the family. So, here it is mostly the family members are given the therapy as to how to help the client and provide a kind of a moral and social support. Then last but not the least, group therapy can also be used in dealing with personality disorders. So, in this group therapy, generally people who are suffering from these kind of the personality disorders are brought together. They were given the freedom, they were encouraged to speak out their own experiences, their own behavioral patterns as to how they are behaving, under what situations they are behaving, how they are reacting to the different situations. So, in this therapy, when they see other clients also behaving, also suffering from a similar kind of a problem, they try to share the information that is given by the others, which may help them in understanding their own feelings. And basically in this therapy, we use group dynamics, peer interactions to increase understanding, communication and also improve social skills. So, this is about the cluster B personality disorders. Let us see the main difference between all these types of personality disorders in the cluster B. For instance, if you look at the histrionic personality disorder, the main predominant symptom in this disorder is people with this disorder revolve around attention seeking behaviors, and they try to get the attention of the others mainly by confining to sexual conquests, and they also display the irresistibility to seduce others. That is the main predominant symptom, that is attention seeking by involving in the sexual conquests and trying to involve in the seducing others. Whereas, if you focus on the narcissistic personality disorder, which is another important disorder in this cluster B, they have a high sense of fantastic grandiosity, brilliance, perfection and also power to dominate others. But these people lack empathy, highly exploitative and compulsively they seek narcissistic supply of attention, admiration, adulation and all these aspects are involved in this. And sometimes their false self is also getting affected because they are involved in this kind of a manipulative behavior. So, this is the main symptom in the narcissistic. Coming to the antisocial personality disorder, they have a main disregard for others. These people ignore others' feelings, others' rights, others' emotions and others' thoughts. Even the others' preferences are completely kept aside, and this is evident when you see in the social interactions. Normally, like these people try to focus on the getting the edge of the others by trying to focus only their own point. So, naturally there is no feeling towards the others' behavior or others' actions. And finally, if you look at the borderline personality disorder, the main symptom is instability. The patient here is a roller coaster of emotions. The patient fails to maintain a stable relationships and dramatically attaches to or clings to and violently behaves in a way that is harmful to the others. And these people, though they get married, but still have a very unhappy married life because they cannot be a good partner to the person and also cannot maintain good relationship with the friends. Self-image is very volatile, that is one's sense of self-worth is fluctuating and precarious, and it is always unpredictable and also inappropriate, and even their impulse control is impaired. So, this main instability is the predominant symptom in borderline personality disorder. So, in short, these are the main differences which exist among the cluster B personality disorders. Now, to summarize whatever we have discussed about the cluster B, there are 3 different categories, and each category though has a common symptom of instability, manipulation, but apart from these 2, naturally they have their own patterns of behavior which affects their relationships with the others, and even the people try to make a distance from these kind of the people with personality disorders. And the causes are many, the exact cause is not known, because in different situations, in different cases, various factors play an important role. But altogether an interplay of biological, psychological and environmental factors contribute to the development of these personality disorders. And there are varied treatment approaches in dealing with personality disorders. Among them, cognitive therapy is highly beneficial apart from behavior therapy, psychotherapy and group therapies.